Exhale Radio. I am your host, Denise Nolan, and I know it's so many of you out there right now that's really thinking about your health, your fitness, and just some of the things that you really want to know about. Well, guess what? I have someone on the line with me right now. His name is Dr. Ivan, and I'm telling you, he has a campaign going right now, which is called Health is Wealth. So we're going to go ahead, talk to him now, find out what's going on, and maybe you get some healthy tips of some things that you can possibly do to better yourself. How are you doing on today, Dr. Ivan?
Hello, Denise. Thank you for having me on your show.
Yes.
Pleasure to be here.
Thank you. Well, I have to start out to say, I know you are a director of physical therapy. Can you tell me just everything that you are as far as, you're a physical therapist? Can you just go down the list and let the listeners know who they hear right now?
Okay, sure. So I have my doctorates in physical therapy. I graduated from NYU. It's a clinical doctorate degree. So for the most part, I'm in rehabilitation. I'm board certified in orthopedic rehabilitation. I'm also board certified in sports rehabilitation. I am a certified movement analyst, and I'm also a certified strength and conditioning specialist. I've been teaching over 10 years now at a local graduate level school, New York Medical College. I run a practice. I run a outpatient private practice where we see predominantly orthopedic and sports. I think one of the things that makes us unique is that we take on a very holistic approach. We are firm believers that in order to heal, you need to have the right therapeutic environment.
Yes.
And having that environment requires that you're sleeping the right amount of time in order for tissues to repair. You're eating well, because in order for a successful rehabilitation process to occur, what you put in your mouth will determine to a great effect, how well you will heal and how quickly you will heal. So we're proponents of all the dimensions that contribute to health. Definitely stress management is a big one, regular physical activity. So our approach kind of runs the gamut of how most people would describe wellness, being that it's multidimensional.
By you mentioning some of the things as far as being able to get enough sleep, make sure you're eating the correct foods. I just think of myself, I try to write down different goals and things that I want to accomplish with my health. And as you know, and I know, I may write some things down, but life happens and things start to change, or that day may not go the way that you want it to. So even for me as a person just starting out saying, hey, look, I want to start losing weight, I want to start eating right, how would you encourage our listeners who just want to start on having a fitness, a different lifestyle, I guess you want to say?
I think the first thing it comes down to is establishing the right mental state. You have to have a vision, you have to have the desire, and just as importantly, you have to have the willingness to go through the phases of what it takes to make a transformation. And I think it all starts with the mind.
Yes.
This is something that I recently addressed in my campaign that you alluded to earlier, Health as Well, where in the first week, we spoke about, in order to embark upon any transformation, a wellness transformation, the mind has to be there. It has to know that, you will encounter some type of struggle. And that's part of any transformation process. Right. Anytime you're starting something new, you got to be realistic. You want to make realistic expectations. Mm-hmm. And I think, there's something to be said about short-term goals. You don't want to be too lofty. You want to set very concrete goals. So, for the first week or for the next 3 weeks, I'm going to work out at least 3 times a week. For the next 3 weeks, I'm going to get at least 7 to 8 hours of sleep. Mm-hmm. For the next 3 weeks, I'm going to meditate for 5 minutes every morning when I wake up. Mm-hmm. And so, it's having structure, having the vision first, and then through education and learning, having the structure, and then the willingness to continue and forge ahead during the process. But one of the things that I often tell patients and certainly the listeners of my most recent campaign, certainly your listeners, is that there's going to be a struggle phase. Anytime you embark on something, there's going to be a part of your body that is going to pose some resistance to what you're embarking upon. And that's when, you have stress hormones being apparent. You're going to have epinephrine and all these stress hormones, these fight or flight hormones are going to be active. And that's good. When you're exercising and you're doing something that's somewhat unfamiliar to you, it's good to have some stress hormone. Yeah. Because that's going to make you sharp. It's going to make you alert. But you don't want it to be overwhelming to the point where it starts to crowd your mind. And so these are, what I'm telling you is some of the things that I mentioned to people that are looking to start a program. Don't expect it to be easy. There will be some struggle initially, but the human body is dynamic, it's magnificent, it's highly adaptive, and your brain, your body, your spirit will all adapt. Your mind will adapt. And soon, before you know it, you'll enjoy all the dimensions of wellness. You'll enjoy going to the gym. You'll enjoy getting a restful night's sleep and meditating and eating well. So that's all part of the journey. Just embracing all these things and understanding that you have to embrace the process and not be one to think that there's going to be an immediate gratification, because there's no such thing as having that when you're looking for optimal wellness.
Right. Yes, and that's one of the things I think where sometimes people, like I said, tend to get discouraged because they're not seeing the results as quickly, I guess you would say, as, you would want to see them. But like you said, it'll happen. It takes time, and setting those small goals will definitely help in the long run for you to see progress and be able to, like you said, just have 8 hours of sleep. Some people don't get that right now. And trying to get that done and making sure you go to sleep, you'd be like, okay, well, wait a minute, I need to go to bed at this time. And I'm telling you, since I know I've been trying real hard to get the 8 hours, it has made a difference when I'm at the gym, when I am trying to work out. So that's great information. And our listeners, I want you to make sure, go ahead and try some of the things that Dr. Ivan is telling you to do. Now, how did this become important to you as far as fitness and wealth and physical therapy? Because you mentioned that you started teaching about 10 years ago.
Well, I teach, my teaching is very specific to rehabilitation.
Okay.
I teach electrical modalities, so it's, somewhat outside the scope. But, I personally, I'm a fitness enthusiast. I'm definitely an academician. I would classify myself as an academician. Okay. And being a proponent of wellness, you're an active learner. You're constantly learning. And I've had my own personal trials with wellness.
Okay.
And one thing that I want the listeners to understand is that wellness goes well beyond skin. Not more than a year ago, I endured a great deal, a great deal of personal and professional hardship.
Okay.
And if one would have looked at me, they would have thought that this man is very healthy. He epitomizes health. I was 6% body fat. I was extremely lean. I was strong, vibrant. What wasn't apparent is my stress. My stress levels were at the time, they felt insurmountable. Oh. And, at the time, I often equated wellness with